this episode of Africa Health Check.
Psychologically and mentally, COVID really affected us. I mean, with the loss of business.
Chuo kilifungwa na hata baada ya hapo nimelazimika kumaliza masomo yangu online.
We delve into the impact of psychological factors on disease prevention practices.
We should create more awareness because a lot of people are depressed. They just don't know that they are depressed.
And the importance of culturally sensitive approaches in promoting health and well-being. Disease prevention is a critical aspect of public health, particularly in the African context where the continent has faced numerous health challenges, including emerging infectious diseases and pandemics. On today's episode, we will be discussing the psychology of prevention. I am your host, Paladi Morokozo, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Moreithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Before we hear from our panelists, let us have a look at this episode's feature story.
My name is Shine Basil Mapunda. I am from Dar es Salaam. I do business, accessories specifically. I sell accessories, wholesale and retail. I didn't know that I was depressed. I didn't know. It just happened. And it was a very difficult time in my life because I thought I was okay, but I wasn't okay. And then from there, I started isolating myself. Like, my mom doesn't love me. Though at some time, she had to agree with the situation. But I, myself, I wasn't okay with everything. So yeah, I was getting pressure from everyone. So it was the exactly moment that I knew, okay, Shine, you're not okay, you're depressed, is the moment that when I had suicidal thoughts. You know, I started in a very good Christian school, so like the faith in me, there wasn't a day I would have thought that I would take my life. So like, I was like, hey, this is not you. Something is wrong with you. So after hearing it from my mom, I was like, okay, kumbe it's okay to speak everything. Yeah, so that's how, when I got a therapist. Let's talk about the mental health. Like, the community doesn't understand fully what that is. People do end their lives. Kids, not only grown-ups, we have kids, we have women, men. Like, community keep on judging, like they don't know what is happening. Or maybe if we were engaging the community oftenly, probably we could prevent a lot of stuffs. As an individual who was and is battling depression, I think we should create more awareness because a lot of people are depressed. They just don't know that they are depressed. So yeah, we need to create more awareness. I have a few things that I, for myself, they have helped me to prevent, not to prevent now, they have helped me to deal with the situation, but I think they might help others to prevent themselves from having psychological problems. The first thing is to love yourself. this is very important. Like people just say it, but they don't truly love themselves. Like, love yourself first. It's okay not being okay. You should embrace it. Like, it's okay not being okay. Don't judge yourself, don't pressure yourself. Everybody does have problems. It's not only you. Yeah, mental health is real. Mental health is real. People are not doing it purposely. People are not faking. These things happen. They happen, and we need to help each other. Like, we do need to help each other. We should talk about it more oftenly, like how we talk about HIV, how we talk about malaria, how we did talk about COVID. Like, we should do the same. Mental health is real.
And with that, we will jump right into the discussion. And let me start with you, Dr. Mary. And we're talking about the psychology of prevention. So maybe perhaps just unpack that topic for us. What are we talking about? What does that entail?
Well, it's a very important topic because I guess it's trending all over: mental health, psychology, and how we take our perspective on several issues. So for me, my understanding of psychology of prevention is the behavioral changes we'll employ or use or utilize to change a certain situation, to prevent a certain situation from happening or occurring, or a disease coming up, or identifying different triggers that may precipitate to a bigger problem that may require a bigger intervention. So for me, we start off with prevention is better than cure. What are the triggers in a society that may lead to lifelong traumas, or traumas that may affect our society from not thriving? There are so many. There could be a terrorist attack. There could be a pandemic that may come, a flooding, or all these issues you're dealing with, climate change. So in a society, how we addressing them, how we preventing them from happening over and over again. And for the people who are experiencing the trauma or the effects, how we assisting them as a society. Are we calling it by name, or are we burying our heads in the sand and really avoiding it or stigmatizing a certain issue? So this is a huge Pandora box, Gigi, you're opening. And I don't know where we're going to go with this.
Well, we can start off with contextualizing a bit, Reverend. Perhaps let us talk about, when we're talking of psychology of prevention in the context of Africa, what does that entail?
Well, the Africans' total belief about life has sources. To the African, life also has to deal with the spiritual, the intangible. It's not belief system. It's indigenous in most African cultures. So then disease formation is not only what biomedical sciences tell us, that you have this disease because we found this. To the African, it could be something else or additional to that. So then preventing the disease or curing the disease is not only taking the pills. In fact, in most cases, they will tell you they have more healing outcomes, from the traditional belief system than even the medical sciences. And that is the psychology of the African thing. So then, trying to advance healthcare, trying to advance these things we're talking about, we have to consult the African mind and find ways where we can actually convince the people, once again, knowledge. Because we are talking about culture. And just before we started, is culture static? What is culture? Culture is the way people live based on assumptions, learn patterns. I did a little bit of anthropology at graduate school. And you come to understand that culture is not static. Based on the outcomes. If what you keep on doing is not yielding the result, then why not change? So then we have to brace ourselves and say, hey, this is our psychology about this. It's not working. It's not producing the result. Let us borrow. Let us lean to these researched things and leaned onto them. So with the African, bypassing their thinking patterns, their psychology of life, of disease formation, progression, and healing is not.
And maybe just to tie into that, you really raised a very important component about culture, and culture is a very important part of our being, our identity, and our way of living as Africans. We're saying prevention is better than cure, and when talking about preventative mechanisms, how can we mitigate culture, religion, science in order to make sure that we use all of these components for promoting healthier living, healthier practices, and of course to support our preventative mechanism when it comes to responding to public health emergencies?
Yes, so we really also need to listen, identify with a particular culture. So whatever my culture advocates for may not work in the reverence culture. So you really have to first immerse yourself with the population, with the community, know them, take time to know them before you start coming up with a preventative strategy and it's very foreign to them or goes against their culture. I know we have a lot of taboos, right, from menstrual hygiene to female genital mutilations. There are communities that this is embedded in their culture. So you cannot just go there with placards and say it's evil, it's bad, but so you have to then approach it in a way of learning, education, and you start off by showing them, okay, this was the culture, but the danger is, let's say now for female genital mutilation, this woman is going to suffer giving birth. Do you remember that case? And then the older women remember, oh, yes, I did struggle, or I had such a long, prolonged labor, or a fistula happened. All those are birth complications. Oh, you mean this practice results to this? And that way now you gain their trust, you meet them at a point of need, and then now educate them. How do you prevent or promote better maternal outcomes in that certain community? Maybe let's start with the female genital tract, female genital mutilations. Are there any other cultural ways for this woman or this girl to translate to womanhood? Maybe let's embrace that and then listen to them. Is it something acceptable? And if it's not, what else? Where can we meet each other halfway? Yes, it's a hard thing to change someone's culture, someone's belief,
mindset,
but it starts with a dialogue, identification with the community, and then slowly that way they win your trust, and then we prevent all these outcomes that I've given an example of.
Yes. I don't know if you want to add on to that, Reverend.
Yeah, I agree with what Dr. Mariam said. To do anything otherwise is disrespecting the people and their belief systems. Absolutely. And that is that you just hit a wall. No, nobody will want to listen to you. Yes. So it's identify with them.
That's true. That's true.
And then you can find ways to chip in gradually.
Absolutely. And the idea is not to shun cultural practices, it's, to find ways of making all of these to work together to complement each other. So we're talking prevention, protection, saving lives. So it's not culture versus health or anything. It's about how can we have these components complementing each other to save lives and to promote healthy lifestyles.
That is why if a people group, a community, has someone that has a new understanding, new information, can go back to them, they accept the person more than a stranger.
Yes,
because
absolutely.
we are one of them.
Yes.
My thoughts about the vaccines are we should accept the vaccination because it helps life. Because when you get vaccinated, you will be quite good. Because let me say you've got the disease, it will be quite expensive for you to get the medical part. But when you get vaccinated, it's quite easier than waiting until you're being diseased. Thank you.
What I do to maintain my healthy lifestyle is simply taking some good food, though it's very costly to do that, and taking some exercises, and also researching for some awareness that can improve my way of approach to medical system. of my very self.
I think that we need to invest in basic health things that they need. The mothers need very basic health commodities to be able to deliver. The children need very basic things, vaccinations and feeding and things like that. If we don't invest in those primary healthcare level things, it's going to be very difficult for us to achieve the good outcomes for mothers and children. And that's the beginning of improving health systems, because delivering is not a disease, it's planned, it's part of society, it's part of continuity. And unless we appreciate it that way, it's going to be very difficult for us to improve the lives and health outcomes of mothers and children.
Dr. Mary Ann, I want us now to look into the influence of population growth, urbanization, and climate change to prevention measures.
Well, that's a loaded question. Climate change, health, etc. Wow. For me, I'll start off with just saying again, prevention is better than cure.
Yes.
But what I've experienced throughout my career, when I engage with different groups, they always have this notion of, you know what, we'll deal with the problem when it comes. We'll deal with that disease when it comes. For now, I'll continue my life the way it is. Good example, I was talking or advocating for HPV vaccination for girls, and the mothers were like, no, we'll not take our daughters for that vaccine. I know, yes, cervical cancer, but we'll deal with the outcomes when it comes. So now, no, I'm not having my daughter get that. And that's just perception of maybe misinformation these mothers have had. In terms of climate change, people still deny it's there. And people still do not link the different effects of the weather. The different patterns we are seeing, flooding, deforestation, all these have an effect of the outcomes of our general well-being. So what are we doing about it? Are we talking about it enough? Having women go to the forest, cut down trees because they need firewood. Are we giving them also alternatives? Are we giving them other alternative measures, as much as we're talking about preventing or advocating for awareness of climate change? So in our psychology in Africa, I think we need, first of all, to embrace the problem, identify the problem. You know, don't bury your head in the sand. I was also in this other women's group where they were really against vaccines in general. It was during the COVID-19 era, and they kept saying, hey, you know, when I was growing up, I didn't see polio. I didn't see this disease. So why then are you coming here scaremongering us about vaccines? They're not longer there. And I had to go back to the drawing board with them and ask them, do you know why they're no longer there? Do you know why you no longer see polio cases? Because of a vaccine. Yet you're refusing this COVID-19 vaccine, yet we have living examples. You've already said that. You don't see measles anymore. But do you know, it's not by magic, but it's through a very big campaign in the 80s where, again, there was vaccination. I don't have that scar. There's a scar that majority of us born before 1980 have. And this was a smallpox vaccine. And why don't I have the scar? This was not my conversation with my mother. And I told her, you know what? Because all of you during your generation, you had the smallpox vaccine, and during your time, you were able to eradicate it. You prevented me from ever getting that infection because of a decision you made. You got vaccinated. So why would you refuse the COVID-19 vaccine? And again, it's just having a very good discussion, no hostility. When it comes to maybe now when you mention climate change, identify with them, remind them, when you were growing up, our weather patterns were very consistent. Now we don't know whether it's raining or sunny, or we can't really even project our farming. Why is that? Because of something of that phenomenon that you're calling climate change. So it's having a conversation.
Exactly.
Yes, it starts the conversation, ends with a conversation.
Yes, raising awareness, public education, but coming with a view of wanting to understand where the community is coming from. Reverend, you are a community leader, and I know you've been engaged in many initiatives, campaigns, projects around preventative measures. Maybe you could share some of the successful campaigns or initiatives you've been part of that were also using culturally sensitive approaches.
As a pastor, a religious leader, using this, this topic, psychology of prevention, psychology in the administration of healthcare, I'm looking at IVF, in vitro fertilization, and our African mind about childbearing and what goes on in a thing. And we come at, we hit walls, because at the end of the day, the people turn around to tell you, listen, it's God who gives children. If God will not give me any child, I don't think that this thing is appropriate for me to do. It's quite difficult. But like we are saying, if we can find common ground and give more knowledge and encouragement, some of the people yield. I know couples who could never have children, and they go to the hospital, they check the man, and the sperm comes so low, and he will never take any medication, he will never see any doctor, because in his mind, it is God who gives children, not him. And what you can see the response of the woman, and in many cases, other cases, let me say, a man can be so angry that a woman is giving birth to girls only. Why? And they divorce them for that. And you try to explain it to them that yes, even though it's God who gives children, but when you look at the man's chromosomes, the women's chromosomes, the man who determines the gender of the baby. It doesn't work. So you need to be in continuous conversation, knowledge impartation, and encouragement to be able to break. Because for some people, it's a taboo. And taboo means this is our belief system. This is what we believe in. This is how we have lived. And you come in with something else, it's not appropriate.
Yes, absolutely. And maybe speaking of encouragement, could just take the last word from you, Dr. Marianne. You're talking about how a lot is happening in the public health sector. We're seeing public health practitioners raising awareness, preaching about prevention is better than cure, as the key message. But, they're still facing a lot of backlash from the society, from community, and a lot of resistance. Maybe a word of encouragement to them.
I would say don't give up. Please continue what you're doing. Your voice will be amplified. The more you keep talking, the more you also give examples. Live and work by example. Yeah, don't just be preaching, but live by example. If you're advocating for a healthy lifestyle, then I meet you in the pub with your beer and your cigarette, the message is lost in translation there. So as well, keep well. Do your exercises, meditate, take time off if you have to. But we want a thriving health practitioner out there, because also people watch. People look, people see, hey, what is Dr. Marianne doing? She's going running. I wonder why. And that way you start engaging in a conversation. I mean, look at COVID-19, wearing of masks. First, it was scary. Why are you wearing a mask? And then if you kept on going on, washing your hands, distancing, people learned from you. Again, vaccination. We had the head of our health, the minister and also the president go for vaccine, because at that point there was a lot of hesitancy, and they did it on live TV, and that was by example. For me, in my own little community, I took a lot of pictures when the vaccine was being given and circulated it within the groups, and again people kept watching me for a whole week. Did she fall off? Have you grown another head? But I continued thriving, working, and talking about, I even started a blog talking about any symptoms that came up with. And in that way, so people around me, my community now, very confident, to go for the vaccination, because nothing happened to Dr. Marianne. So as a health practitioner, live by example. Keep doing what you're doing. Don't get discouraged. You'll get a lot of negative feedback sometimes, but again, then always back up whatever you're selling, whatever you're saying with facts.
Yes, yes. I think that's really, really profound. And at the end of the day, it's just to remember as public health activists, enthusiasts, leaders, that at the end of the day, people will follow your example more than your words. So thank you very much for that. Absolutely.
Doctors who smoke and drink booze.
Absolutely. Thank you very much for that. Before we wrap up the show, I'd like to take a look at our African health champion for this episode. Dr. David Moinana Senge, who's the Minister of Basic and Secondary Education and the Chief Innovation Officer for the government of Sierra Leone. Let's have a look.
For our feature Africa Health Champion on this episode, let's meet Dr. David Moinina Senge, a force driving positive change in Sierra Leone and beyond. As Minister of Basic and Senior Secondary Education and Chief Innovation Officer, he's reshaping education and healthcare. An accomplished biomechatronics engineer and data scientist, he holds numerous patents and publications. Beyond his professional feats, he's an Afrobeat artist and clothing designer. Dr. Senge's visionary leadership and commitment to accessible education and healthcare mark him as an Africa Health Champion, paving the way for a brighter future on the continent.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same day, remember the future is Africa, the future is today.